I'm Val Wolf. I'm an executive director at OCOW, and I'm happy to welcome you to Mayday Mayday 2024. And it is the second event of that series. It's a 5-week series, and I'm really thrilled again to welcome the COPSOQ network and particularly the speakers from all corners of the world who have come to share their experience with the COPSOQ survey, which we also use with our survey tool Stress Assess here in Canada. But it's also used around the world, and it's really always interesting to hear how it's being applied and what people are learning from it, and how different workplaces can benefit from it. So I'm actually just doing the introductions today, and I'm going to turn it over to a member of the COPSOQ Network executive, Herman Burr, and he's going to be the guest host, and we really appreciate that too. So it adds more of an international flavor to our discussions today. So Herman, over to you. Thanks everybody for coming.
Hello everybody. Today we will be able to listen to presentations from many parts of the world, starting in New Zealand. Then we are going to Moscow, and then we are going to Libya, where the presenter is cooperating with colleagues from Turkey, and then we have also a presenter from Belgium, and the first presenter will be Fatima Junaid, who will talk about COPSOQ in the fishing sector in New Zealand. And Fatima Junaid is from Palmerston North on the North Island of New Zealand. And her presentation is recorded. As you might know, it's 2 o'clock in the night of New Zealand. So therefore, we will have a recorded presentation from her.
Hi, kia ora and salam everyone. I'm Fatima Junaid. I'm going to talk about using COPSOQ in the commercial fishing industry within New Zealand. If you saw me last year at the COPSOQ conference, I talked about this study's methodology because we were planning this study. And so from June till the end of the year, we conducted this study. This was a collaboration between my university and Maritime New Zealand, which is our national fishing regulator for commercial fishing industries, and First Mate and Guard Safety, which are our national level well-being service providers specifically for the fishing sector. So these were my team members. We started thinking about this project of using COPSOQ to understand psychosocial risks within the fishing sector back in 2021. And for about a year, we kept talking about how should we look into psychosocial risks for fishers, because just like globally, even in the New Zealand context, sustainability of environment and water is really something that is constantly being discussed and is on the political agenda. However, the sustainability of the fishers is something that hasn't been talked about much, especially from the well-being perspective. So Being the COPSOQ representative for New Zealand, I was part of a conversation, a discussion panel, which was within the fishing sector, where our national regulator for health and safety, WorkSafe, was sharing their study results, looking at COPSOQ, using COPSOQ and looking at psychosocial risks nationally. What was realized was that within the national baseline study sample, fishing sector wasn't represented. So from those conversations, we developed this collaboration, and we conducted a 3-phase project where we consulted with the fishers, collected data, and consulted with them again to sort of triangulate whether our findings and adaptation of the survey was effective or not. I'll talk about this. So the project aim was to have an industry-led approach to indicate what was going on for people and from the perspective of psychosocial risks and stressors. And our focus was to use COPSOQ because then we could inform the national baseline study as well. To do so, what we realized was that we would need to do a pilot project. So this is the pilot project that we did. Knowing that fishing is a high risk industry and not having enough data about it, Maritime New Zealand commissioned this study to understand the psychosocial risks, which we did in 2023. We developed the methodology through consultation with the fishers. FirstMate, our well-being service provider across New Zealand for fishers, was on board with us as consultants for the project. And I presented the idea of the conceptualization of the methodology at the last year's conference and got feedback as well. Based on that, we adapted the survey. So what did it look like? The first phase was a consultation process with the fishers. We sent out invites to quite a few people through FirstMate. We had more people agreeing that they would come, but eventually we had 13 participants, fishers, coming from deep waters and inshore fishing. For a whole day, we conducted this session. It was like a focus group workshop. The first part was where I presented what was COPSOQ, what were the questions, why did we have those questions, what were the constructs that it was measuring, and what had WorkSafe done nationally. The second part, after morning tea, during lunch, and a working lunch, was them looking at the questionnaire, attempting the questionnaire. We didn't use that data, but just to understand how the questionnaire works. And then this third part of the day was, after lunch, was going through each and every question, looking at the language and relevance. What we found out was that they wanted us to simplify some of the words and change some of the words. I have discussed these here. For example, manager was changed to skipper because skipper is the manager at the boat. Co-workers were changed to mate because that's the term that they use. So we changed the titles of the roles that are within the questionnaire. We also changed some of the wordings by writing alternative wordings in brackets so that they can understand what the question is. these are some of the examples. So you can pause the video and spend some time here. And if you have any questions, I'm more than happy to respond to them. You can write to me. What we found was that, so we asked them if there were any additional questions that they wanted us to put in the questionnaire, and if there was any aspect of risk that we had not addressed in the existing inventory. What we learned was that, for example, in the fishing sector, a key important risk was meeting the regulations. If you don't comply with the fishing regulation, you could be heavily fined, and worse can be that your boat is taken from you. And if your boat is taken from you, then you don't have a vessel to take for fishing. Why would you not comply? Because the regulations are very complex in language. They keep changing because they are dependent on the national and international regulations. And as we know that sustainability research is constantly growing, the regulations are also changing. This meant that there was like a load, the way we have cognitive load, and B, there was a worry. So we realized that the questions which were related to regulation compliance load as a cognitive and cognitive processing load, we couldn't plonk it on any other construct. So we created it as a separate construct. Compliance worry, we couldn't add, and we didn't want to add to any other questions. So we created it as a separate construct with these 3 questions. The questions and the title for the construct were created by and with the help of the fishers. And the other edits you can see in the questions that we have shown to you. Interestingly, the rest of the questions they thought were valid and important and useful. Now, the national survey didn't use the entire long version of COPSOQ. However, in our case, they did suggest that we should keep the negative acts, all of it, and also the well-being outcomes. And so we used the full version in our pilot of COPSOQ for our study. Why was regulation a load and a worry? And so these were some of the reasons that they had provided to us. They did say that it was useful because fishers like to meet face-to-face. So one of the things that we realized for a survey was that now we had the survey and we could, adapt it to the needs of fishers. But they still suggested that it should not be online and email, it should be one-on-one. So we had to think of a way to distribute it in a face-to-face interaction. First Meet, our well-being service providers, have navigators. Navigators are trained in relation to well-being and health and safety with both Western and Indigenous perspectives. So they understand both the perspectives because some of our fishers could come from Indigenous background, Maori background, others are what we call Pakeha from the Western background. So they are trained and they regularly connect, meet, and provide support services for and to fishers. So this was important because navigators already know the fishers. Many of them were previously fishers. Also, they are trained to provide support. And third, if, for example, while answering the survey, if the fishers feel stressed, they will have support from the navigators. What survey concluded was that while there were other factors which were adversely affecting or which were psychosocial risks for the well-being of fishers, the key risks were regulation and worrying about regulation, and after that was work safe. We had 47 people who completed this pilot survey to test the wording and understanding of the survey. So this was our pilot survey distribution and analysis. So that was our phase 2. The navigators also came back and gave us feedback in relation to what they heard from the fishers in relation to the survey. Phase 3 was that we had committed to the fishers in phase 1 that once we complete phase 2, we will ask for feedback from fishers, some who were present in the first phase, but others who want to join us, to go and look at in-depth analysis of what we have done and what we've learned through the survey, and tell us if it resonates and if it has captured what the psychosocial risks are within the commercial fishing sector. 9 people met with us. We forwarded our analysis document to them before the meeting so that they could review it. We had a 2-hour scheduled meeting, but it went on far more, where we met on Zoom and we went through each construct and its findings from the pilot survey and asked them whether it resonated with them. Because we only had 47 people who had responded to our pilot adapted survey, we couldn't run advanced statistical, even reliabilities and validities from a statistical perspective, but we did get the feedback in a qualitative manner from our participants. So this is the presentation was 25 minutes, discussion was supposed to be 45 minutes. We had scheduled 2 hours, but it went on long. And myself and Andrew, we took questions and responded to the fishers. In this third part, we asked the fishers to also give us feed forward. Is there anything that we've missed in this entire survey? What could we improve, and any other comments? The only thing that was pointed out was that in the demographics, we should have the education level as well, which was not one of the questions that we had in the pilot survey. Now, you might ask, why have I not shared all the findings, although they are available and with the IFISH 6 on the IFISH 6 conference page. I can send you the link if you wanted to, but the report is sitting with Maritime New Zealand. They are reviewing the findings because we are talking about regulation and worry as psychosocial risks, and because Maritime New Zealand is our regulator. So they are looking into it to see how can, you know, that it is worded correctly and it meets all the requirements, legal requirements of the organization. However, we've provided future research directions, which they've actually, which have been received very positively, that we should scale up the study project. And alongside or while we do this project, we communicate with fishers to understand, you know, the best way possible to understand their psychosocial risks, how they want to tell us Also, if we can use COPSOQ and develop a well-being framework for them, looking at the different kind of psychosocial risks that are highlighted. So that's how we did the project. It was a pilot study with 3 phases, starting with Fisher's consultation face-to-face. Then based on that, we adapted the questionnaire. We didn't change the existing constructs. In most of the cases, we used the full length. We added additional constructs because in that way, we could retain the COPSOQ and make it comparable to our baseline study that has been done by our national regulator. Alongside, we could we also had the separate constructs which were relevant to the fishing sector. The only changes mainly that we made were 2. One, changing the terms used for manager, co-worker, workplace. We replaced it with vessel or boat. And we also, in some cases, provided slightly simpler wordings in brackets so that they could understand. It has been received very positively by the fishers. We presented this study and its findings in the IFISH at the FAO in Rome this year. It was attended by literally all the fishing community and fishing researchers across the globe. It was received very positively, so I'm very pleased with that. That's the end of my presentation. I'm really sorry that I can't make it to the live 2 a.m. my time, but I'm sending you this recording and I hope you find it useful. If there are any questions, you know where to find me. You will have my email address. Thank you so much. Bye.
That was a very nice presentation. The presentation highlights 3 very relevant issues. The first issue is that usually when we deal with work and health, we forget those on the sea. We forget those on the drilling platforms. We forget those who work on the seafarers on vessels with goods from between parts of the world. Those who carry passengers from one island to another, so here we have a presentation dealing with an area that that often is forgotten or not part of regulations of work and health. And then we have another issue here, and the other issue is that COPSOQ and also those dealing with work and health in general do not take up the issue of those who are self-employed. And a lot of workers are more or less self-employed, and these additional dimensions that Fatima here suggests could also inspire for using COPSOQ for those who are self-employed.